Hi there, I'm Kathy Klein with Medicare Quick, and today I'm going to show you how to use the new 2020 Medicare.gov website to find the plan that will save you the most in your medication costs. So the first thing that we're going to do is hover, don't click, over the Sign Up Change Plans on the Medicare.gov website. Then we're going to click on Find Health and Drug Plans. Now this brings us to a site that says log in or create account. Now starting this year, brokers will not be able to save the information that they enter. So if you are used to having a broker or an agent do this for you every year, it's going to be much more difficult for brokers and agents to do this because in the past, when we entered, let's say you had 20 drugs, we could save them using the user ID and the password date. This was not connected to your site in any way, and so it was, in a way, confidential. But now, in order to save the information, you have to log in or create an account. And obviously, brokers aren't allowed to log into your personal account. So in the future, starting this year, the end of 2019, I'm highly recommending that you create your own account. Now, I'm not going to do that today, but I'm going to show you how to do this without actually logging in. So we're going to click Continue without logging in. And let me just turn off my picture. So then it's going to ask you what type of coverage that you're looking for. I suggest that for our purposes today, we're just going to click the part that says drug plan only. If you're working with a broker, you probably already have a Medigap policy. And if we're looking at Medicare Advantage plans, I'll do that in a separate video. So we're going to go ahead and click drug plan and then enter your zip code. For this instance, I'm going to enter 29909, and then I need to choose between Beaufort and Jasper, and so in this case, I'm going to select Jasper. The next question is, do you get help with your costs from one of these programs? And in this case, I'm going to select no. We're going to click Next. Okay, now up here, we are looking at 2020 plans. If I wanted to look at the previous year's plans, I would click on Show Me 2019 Plans. So whenever you are looking at the Medicare.gov website between basically October, in the months of October and November and part of December, you'll have the choice to toggle between the current year plan and the future year plan. But after Medicare open enrollment period, the AEP, the annual enrollment period is over, this up here will disappear. So I'm going to keep it in the 2020 plans. And if I take medications, I'm going to select yes for this question. If I do not take medications, I'm going to select no. So in this case, we'll go ahead and select yes. Now, one thing that I need to let you know is that you cannot use the back key. If you use the back key on this website, you will lose all of your information. Okay, now we're going to select both for how do you normally fill your medications. And that way we'll get more accurate information from the site. And we're also going to select one or two pharmacies that we like to use. Like for example, let's say you have a cold or a flu. You can't really wait for the mail order pharmacy to send that to you. And that's why we're going to go ahead and select both. Okay, so let's go ahead and select a drug. I'm going to select, we'll select Plaxil, we'll add that. And then I have to determine whether or not I can take the generic. If I can take the generic, it's going to be much less expensive. But if I can't take the generic, let's say I'm allergic or it doesn't work, then obviously I would select brand. In this case, I'm going to select generic. Then you'll see the dosage that's already pre-filled, but let me click on that and then I could actually change the dosage amount. In this case, I'm going to select 10 milligrams and I'm going to select 30 a month, which is one a day. I'll add that to my list. And then I'm going to add another drug. I'm going to add Lipitor. And there's a generic version of Lipitor as well. I'm going to go ahead and add the generic in this case. And I'm going to select 80 milligrams, 1 a day, 30 a month. Okay, so now I'm done. If you wanted to, add 20 drugs, you could, which is another reason why you'd want to save this when you create an account. Okay, so now I'm going to select Done. And what it does now is it gives me a list of pharmacies. I can only select 2. If I need to see more pharmacies, I can click this box. But let's go ahead and select Walgreens and Publix. As you can see, it gets grayed out because the system only lets me select 2 pharmacies. Now I'm going to select Done. Now, the next step, I need to sort the plans. I don't necessarily want to sort it by the lowest premium because that's not giving me the whole story. I want to sort it by the lowest drug cost. Now you see that it changed it. Okay, now I can compare up to 3. Right now, because we're doing this prior to October 15th, the star ratings are not available. I recommend that you look at this after the 15th of October, but still during the annual enrollment period so that you can see the star ratings. We usually recommend an average star rating of 3 or higher and overall, and then also an average star rating of 3 or higher for customer service as well. So we're going to add the 3 that we're allowed to add. And then we're going to click Compare. Let me just move that out of the way. We're going to click Compare. So now it's giving me a comparison of what the monthly cost is for premium and what the deductible is and what drugs are covered or not covered. In this case, both of our drugs are covered by all 3 plans. We'll want to select what the restrictions are to make sure that we're okay working with the prescriptions, or I'm sorry, with the potential restrictions. And in this case, it doesn't look like there's prior authorization, quantity limits, or step therapy. But it says contact your plan. So you would want to make sure that there's no quantity limits or find out what they are. So it gives you a lot of information about it. And then we'll go back. Remember, do not hit the back key. Always hit the keys that are from Medicare.gov. Okay, unfortunately, it doesn't save where you were, so we're going to go ahead and click on lowest drug cost, and then we've got the compare already added in there, and we're going to go ahead and click compare. So let's see. Now, in this middle plan, which is Cigna, it shows Publix as being out of network. Now, if you notice, the out of network is very expensive. So if I were to have this middle plan, I would not go to this pharmacy because the cost would be quite high. But as you can see, so what I usually compare would be the in-network cost. So the center one, if I was willing to go to Walgreens, looks like it would be the least expensive. And then if I want more details, I would click on Plan Details, and it would give me the retail cost of the drugs in each coverage phase and what my estimated drug costs would be each month during the year. And so if I were, let's say, for example, I were to run this analysis in May, then this is going to look different. I believe it would start in May, but we'll see because this is a new site. So this tells me the retail cost of the drug, what the cost is before the deductible, after the deductible, whatever. But this is showing me at the out-of-network pharmacy. So up here, it shows me at the preferred in-network pharmacy. You see how that works? You always want to stay in network because out of network, it's going to be quite expensive. And then the mail order pharmacy, this is based on the standard mail in-network. So if there is a preferred network for this pharmacy, you'd want to ask your insurance broker about that. And so this is the other information that you can get. And so I hope this helps, showing you how to use the new 2020 program. You can also, I can show you what it looks like in the year 2019. So the same person for 2019, it would look much different. The one that would save you the most on drug costs would be very different. Now, if you didn't take any medications, that's when you would sort it by lowest monthly premium. So I hope this helps, and I'll see you in the next video.